On today's The Doctor Is In, most of us know what it's like to be tired, but if you suffer from a constant lack of energy and ongoing fatigue, it could be time to see your doctor. Dr. Scott Ackerman, one of the First Coast's leading doctors, is here today to talk about the number of reasons as to why you're tired, why you might be so fatigued, because sometimes it's not as simple, although it could be, of just not getting enough sleep. So one of the things, what is one of the most common, I guess I should say, causes of fatigue?
Well, there's lots of causes of fatigue, and you're right, we'll talk about sleep in a little bit, but really the most common cause of fatigue is anemia. This is the most common blood disorder in the United States. Anemia means low red blood count. It's the leading cause of fatigue in women. If women have a heavy menstrual cycle, they lose a lot of blood, and when you lose blood, you don't have the red cells that are used to carry oxygen. So we breathe. Oxygen goes in, our blood system is carried around the body in hemoglobin, in the red blood cells around the body to provide us energy and nutrients to the body. When there's not enough blood, you're not getting enough oxygen to the tissues, and this causes fatigue.
Yeah, what is another type of fatigue, or what else causes fatigue that you've seen?
Well, another illness that can cause fatigue is diabetes. And so people that don't know it, unbeknownst to them, they have diabetes, and it's untreated, and that can cause fatigue. And what happens there is diabetics have high blood sugar, right? You know the sugar.
Sure.
And they have high blood sugar, and that means they have low blood sugar or low sugar in their cells. All the sugar's in the blood. It hasn't transferred from the blood to the tissues of the body. In order for your muscles and other tissues to operate properly, they need to have a right amount of glucose in those tissues. So if you're not converting the sugar into the cells to convert to energy, you kind of run out of steam. And so most diabetics run out of energy despite having enough to eat. And it's very treatable, because if you're diagnosed with diabetes, it's very treatable with insulin. Sure. Insulin can help you regulate the process, regulate the sugar, and help get the sugar, the glucose from the blood system into cells.
And I've heard, I have a friend who has a thyroid issue, and they say that makes them so tired. Is that something that you see as well, that is a contributor to fatigue? Yeah,
it's more common than you think. A disease called hypothyroidism. Hypo means low levels of thyroid hormone, and this is because you have an underactive thyroid gland. The thyroid gland is at the base of the neck. It's a small gland, and it produces thyroid hormone, or thyroxine, and that controls your metabolism and the speed of converting fuel to energy. So if the thyroid is not working properly, not putting out enough thyroxine, you would feel sluggish. And again, if you're diagnosed with low thyroid levels, it's an easy treatment for that. There's synthetic thyroid hormone that's very, very effective, called Synthroid, synthetic thyroid, and it works very well and can correct that.
And we talked about it at the top of the segment, but getting enough sleep. And you think, okay, I'm getting enough sleep, but really, what is enough sleep for the typical adult?
Well, you know, sleep is an active process. It's not a passive process where you're just laying there. When you're sleeping, it's an active process. Your body heals itself, it renews itself, but it really, it may seem obvious, but not getting enough sleep is a good reason, is a common reason for fatigue. Adults need around 7 to 8 hours a night. You know, teenagers and people and babies that are still growing need a little bit more. So if you're not getting those 7 or 8 hours of sleep a night, you could be fatigued during the day. And there's all sorts of reasons you may not be getting it. One is because you're busy at work and you're out and you're working hard, but also other diseases like sleep apnea. This is when you're snoring, and you're snoring such that you stop breathing during the night. And when you stop breathing, you wake up and you come out of the rapid eye movement sleep, the REM sleep that we call it, and your body isn't repairing itself properly and not renewing itself properly. And there's treatment for that. If you're having a problem with sleep apnea, there's CPAP machines, there's surgical treatments, there's some orthodontic sort of treatments that'll help you to have a better sleep. So listen to your body. You know, something feels off and you're fatigued, see your doctor.
Yeah, and goes beyond just the typical I'm tired by 2 p.m., you know, the 8-hour energy or whatever you have to try to get you going. I mean, this is something that you think to yourself, boy, something's not right. That's when you need to see your doctor.
Right, exactly.
Okay. All right, Dr. Ackerman, thank you so much for coming on. Once again, we appreciate you being here, and Dr. Ackerman joins us every Friday. If you have any questions about this topic or anything else that we've talked about here with Dr. Ackerman, you can visit his website. Very simply, just go to firstcoastoncology.com. Confidentially submit your questions to Ask the Doctor.